This is not focused on an e-health system, but it is more related with intelligent ambience in order to support mass evacuation guidance during emergency situations inside public transport needs. So, just to give you the motivation of this work, we all watch TV and see the news, and we are all aware that lots of disaster events are happening all around the world, not only natural phenomena such as different earthquakes, or also in the Canary Islands that we are expecting a big one, or the problem with the volcano and so on, but also lots of terrorist attacks that are affecting lots of countries in the world. And the truth is that a lot of people is affected, and this is something that authorities are worried about, and they are thinking and studying and preparing emergency plans so that most of the people are saved, or most of the lives are saved in this kind of situation. So what happens during an emergency situation is that all the involved individuals need to react immediately in order to save their lives. So we are not talking only about the people that were walking down the street and are affected by the disaster, but also all the emergency rescue teams that need to go to the place and save them. All of them need to react immediately to support a quick evacuation of the area. So this is especially critical, especially important when we talk about closed environments, because in closed environments such as transportation means, transportation stations or road tunnels, people are more likely to get trapped, so it is, they are a bit more dangerous when we are talking about closed areas. So this implies that in order to support this guidance to escape, the rescuers, the rescue teams, they need precise information of what's happening, which exactly is the disaster event about, where are the people trapped, which is exactly the problem, in order to guide them to escape and to locate the people, to save them. And also the travelers need appropriate guidance to escape, because I think what happens to me when I go into the metro stations, I have no idea how to get out, except for the typical signals of exit, but I don't know anything about emergency plans or evacuation plans. I have no idea, and I have never thought about reading anything that is any information that I would see in the metro station. I just want to get home, and that's it. So the thing is that it would be very important that all the people are read with precise information on what they have to do in order to escape. So this is what this project is about, Save Me project. It wants to provide the technology, an integrated solution to support this evacuation. But this technology has to start from the very beginning of detecting the emergency situation. So the objective is to actively support the life-saving activities and facilitating both the self-rescue of the travelers as well as the rescue teams. And there is a particular emphasis also on the people that have special needs, such as the children or elderly people or people with disabilities, because not always the evacuation plans think about them. So at the first stages of the project, the methodology that we followed started with the detailed analysis of the different target groups, of course, because there are lots of people involved, as I said, not only travelers, but also all the rescue teams, the personnel of the control center of the transportation mean, also the authorities that have to coordinate everyone when a disaster happens. So we performed a detailed analysis of these target groups, also about the key transportation environments and the key disaster events that are most likely to happen inside this transportation mix. And we also studied how the panic and stress influence on these kind of situations, because if you don't take these human factors into account, you may provide a solution that is not useful at all, and I will explain a bit of it later. We made a benchmarking of the relevant technologies, the algorithms, and existing policies that exist currently. And from all of that information, we extracted the stakeholders and user needs. From that, we were able to define a solution that we wanted to provide. So, as I just said, to give you an idea of these human factors, for example, if we are talking about giving the travelers the information to escape, we were thinking about how to provide them interfaces to give them the information. One thing that we first thought about was the thing of the panic, because we thought that it is important to avoid that people panic. And the truth is that from past studies or from past disaster events, we realized that people don't panic. For example, in the disaster of the World Trade Center, people acted actually very pro-socially. They didn't panic at all. So this is something that may get us to an error and to provide something that is not useful, because you are thinking that you have to eliminate panic, and they are not panicking. There are two causes. There are two things that cause panic in this kind of disaster event. One is when people think that they have to compete to escape from somewhere, and the other is when there is no good, when there is a bad communication from the front to the back. For example, that happened in the Love Parade in Germany in 2010, that people were trying to escape through a closed door. And the thing is that the people in the back didn't know that the door was closed. So what happened is that they started pushing and pushing and pushing, and then the people in the front panic because they are getting in a smaller place. So that can be a disaster. So this is something that has to be taken into account in order to provide the interfaces and information for the travelers. The other thing is the stress. The stress is a physiological reaction of the human body to a threat. And the truth is that you don't have to eliminate the stress of the people, because a bit of stress is needed, so they want to escape. Because if they don't feel the stress, the thing is that they will start doing things, silly things that are not useful for them, and they delay their self-rescue. For example, they can start packing their personal things and whatever, and they forget about the thing that they have to escape. So a bit of stress is also needed in the people that need to escape from the situation. So now I'm going to the technology that this project provides. Communication is the most critical thing, the most critical issue during an emergency. So it is the core element of all the project, to provide communication to everyone that needs information. So the challenges include reaching people in different locations with different devices, providing them the right message, monitoring delivery and response, ensuring that the process is initiated and suspended at the right times. So what we are going to do in this project is to provide information through the user's personal device, to the travelers through their mobile phones, different mobile phones, Android platform, iPhone, Symbian platform, and to the rescue teams through their PDAs. They use PDAs to communicate. And they are going to be registered to the system. They will have an application so that when they get, for example, into the metro station, in the case that there is an emergency, they will automatically receive the information of how to escape. These are the main elements of the architecture of the system. On the right hand side you can see the different outputs, the different users that will get this information. So the security operator, the rescue teams, the travelers, and also there will be group guidance through loudspeakers and displays. Okay, so going one by one. First of all is the detection and communication system. It consists of a wireless sensor network that detects smoke or fire, or so they can detect what is happening and where. And also a telecommunication module that allows this transmission of information to all the users. And I will explain in detail later. Then we have the decision support system, which is the core element, the core module of the system, because it is the module that decides that routes for the fastest and safest route, so that everyone can escape. And the main thing in SaveMe is that we are going to provide personalized guidance to each user. So depending on the location of each user, they will receive different escape information, and also group guidance through the displays and loudspeakers. There are the intelligent agents, which are the decision support system is composed of these agents that perform the reasoning and make decisions in order to provide these personalized services. I forgot to say something about the simulation mode. When there is an emergency, this emergency will be simulated during this emergency. Okay, so there will be a simulation of how the users are moving and what is happening. So the decision support system gets feedback in real time of this situation. And finally, the training and guidance system, which is a system that is going to be used not during the emergency, but before or after, to train the rescue teams and the personnel of the operator center. And for that purpose, virtual reality environments are going to be used. Okay, and of course we have the emergency interfaces for each user to provide them the specific message to help them to escape. So going into detail in the telecommunication infrastructure, we have focused on providing high fault tolerance level, which means that of course we can provide a telecommunication network, but if there is an explosion and the router breaks, we still need to provide the communication. If it breaks and the network breaks, the system has no sense. So we were thinking about a solution to provide this continuous operation, reliable and safe, even under adverse conditions. So we have thought about the fault tolerance principles, which consist basically on replicating information and providing multiple different instances of the system, so that no matter router breaks down, that the network will continue, will be operating. So this is just a representation of the network. There will be different routers that will be placed all along the transportation station, the metro or a road tunnel. These routers communicate among themselves using Wi-Fi, but also they will have Bluetooth communication to communicate with the mobile devices of the users. And this network is used to transmit all the information from the sensor detection to the operator center and to the travelers. So each router is composed at this moment. The prototype is basically a PC which has been configured specifically for this telecommunication infrastructure. Two wireless PCI cards are used. One is configured for the network to be in ad hoc mode, which means that if a router breaks, the network will be automatically reconfigured. And the other one is configured in infrastructure mode to to be an access point for the mobile devices. And finally, also, we provide a Bluetooth card so that mobile devices that want to communicate with the network through Bluetooth can do so. On the right, you can see the current status of the router, the prototype. We have selected mini PCs, so it looks like, of course, a router. We didn't want to provide desktop PCs all around the metro station. Okay, it is, as I said, a dock wireless network with routers that have pre-installed and automatic upgradable emergency software. Wi-Fi and Bluetooth communications are supported, and the automatic recalibration of the network has been achieved using a routing protocol which is called Batman, and you can look for documentation about it. And okay, routers will be able to provide the static evacuation plan in case that everything breaks down and the network doesn't work out of it. So how the infrastructure communicates with other elements of the system. Basically, this telecommunication module is something that is under all the SafeNet platform, because it is used to transmit all the information from the very first sensor to the final user, to the final control center computer. So about the evaluation of the system, preliminary tests have been performed in a laboratory environment. So at first we tested the network so that we are sure that it does not break down if one of the routers collapses. After that, the next step is to test it with the other elements of the SafeNet platform. So with the decision support system, the sensor network, and so on. And the final tests with users will be performed in two different pilot sites, one in the United Kingdom and the other one in Switzerland. The first one will be the Nexus Metro network of Newcastle, and the objective is basically to disperse the people successfully to the various remaining escape routes. And in the Gopher tunnel, it is a very long road tunnel, which is between Italy and Switzerland. And the main objective here will be to inform and convince the people traveling in the cars that they have to go outside the cars and escape to a safe place. So just to summarize everything that I said, actually it is a very big challenge to support quick evacuation guidance and information for all the people involved during an emergency situation, a disaster event. And a well-prepared system can significantly reduce the impact of an attack. So technology can support or have a strong potential to support this quick evacuation. So for that, very appropriate guidance is needed for all the users. And we have thought about mobile device-based guidance because it's the device that all users have in their daily lives. And specifically as the telecommunication infrastructure, this module provides consistent replication of the emergency information and is able to communicate and inform directly with users. So after the pilot size, which will take place, I think, in June next year, the test will assess the reliability, the usability, the user acceptance, and also the economic and safety security impact of the whole system. So just to thank all the consortium of the project, and if you have any questions, you can ask.
Thank you very much, Viveca. Any questions from the audience? Well, I have one. I was wondering regarding because I think one of the challenges will be the validation with real users. I assume you will do some kind of simulacrum or something like that.
Yes, of course, it cannot be a real situation.
But have you tested before that the interfaces that have been developed are at least in laboratory conditions useful and people can select, or you will go back directly to do in the real?
No. They were preliminary tests with users, of course, with a simulation. They simulated also the stress or the stress situation that they may feel. So it was actually tested in, I think it's Switzerland, in the Gotthard Tunnel. And yeah, it is not that we tested the already developed interface, but we wanted to test our idea of the interfaces, so to go in that line or not.
Because I assume that the challenge for the next phase of the validation will be testing the whole system, so the telecommunication working synchronously.
Yes, of course. And we are having problems when looking for users that test the application, because you know that we were focusing on people with disabilities and children, and one of the problems that we have is that parents don't want to allow the children. We are saying, okay, we are not going to explore anything, but it has been a problem to find users to test the application, so we will see.
And in that line exactly of this type of users, have you had any problem with ethical? So ethical committees or something like that? Because I assume working with this type of people with special needs, in a way, in a dangerous situation, even if it's simulated, can have more ethical problems than working with helping young people.
Yeah, but as far as I know,
doing something like that.
As far as I know, since I think that everything, of course, is going to be simulated.
Yeah.
It is just the same ethical problems that you may have in other projects where you want to test e-health system or wherever. I mean, we need to ask for permission to the ethical committee, and I'm not really aware about specific ethical problems in that sense.
Okay. So, any other question? Okay, so thank you very much. So,